So, as I say, I'm really pleased that you've been able to join us today. Age Alliance Wales has been around as a network since 2003, and it provides an opportunity for the national charities working with and for older people to come together on some of the key issues. And what's incredibly useful in terms of the Alliance is its breadth, in terms of the different functions that all of us have, and the reach and contribution that we bring together. And that strength's been particularly evident, I think, in the last year. As the chair of Alliance, it's been actually fantastic to work with so many colleagues at what's been quite a challenging time for all of us, and on such a regular basis, because despite all of the barriers to meeting, actually we've found an opportunity to come together probably more regularly than we ever have before. And we've been able to collate and share the experiences that we've had as organisations, and those that we've heard from older people. We've shared those with key influencers, with Welsh Government, to enable change to happen during the year. And it's been gratifying to see actually the impact that colleagues across the Alliance and their teams have made on the lives of older people, whether that's been getting food on the table, whether that's been providing support and social care, or actually supporting the need to overcome the overwhelming sense of isolation and loneliness that many older people have found over the last year. And it's from our collective perspective that we've developed our asks of the Welsh Government. We've all got our own issues as organisations, and no doubt we'll all be sharing those individually in the coming weeks and months. But this is about our shared endeavour and the common challenges that we face, and in particular how together we've changed and adapted over the last year. So I'm going to invite some of my Alliance colleagues to share what they've been up to and the impact on their delivery. And so first of all, I'd like to introduce a short video from Simon Hatch of Carers Trust Wales.
Hi, my name is Simon Hatch. I'm the Director of Carers Trust in Wales. I'm delighted to be joining the launch of the Age Alliance Wales Manifesto 2021. The many charities which come together to form Age Alliance Wales do so voluntarily. Carers Trust is part of Age Alliance Wales because we know that in Wales we can influence more effectively for older people and achieve more change representing older people better when we work together. As we know, the pandemic has been incredibly difficult for older people throughout the last year. I'd just like to say a few words about the thousands of older unpaid carers in Wales and the impact which COVID has had on them. The pandemic has taken a huge toll on older unpaid carers who provide the necessary care and support for family members and others on a daily basis. It's difficult to overestimate how draining the effects of the pandemic have been on older carers across Wales. Many thousands of older carers have been shielding. Thousands of older carers have been unable to access the treatments or care or services which they or the person that they care for needs. And of course, many thousands of older carers have been denied the much needed access and support from families and friends. Older carers have been impacted physically, emotionally and financially over the last year by the pandemic. It's important to highlight that for many older carers, the pandemic has only exacerbated the many difficulties that they faced before the start of COVID. We know that the pandemic has also seen many people start a caring role for the first time, and they've told us how tough this has been. Throughout the last year, and especially in those first few weeks and months, many older carers were struggling to access food and medicines which they needed so desperately. Older carers have told us about the increased hours of caring that they've had to carry out without access to any of the services or support which they'd come to rely on. And above all, older carers have told us about their worries in trying to keep themselves and the people they care for safe, particularly if they had or have underlying or complex health conditions. From the start of the pandemic, charities which make up Age Alliance Wales have done an incredible job in going above and beyond to support older carers in Wales. Over the last year, the Age Alliance Wales charities have provided a range of practical, emotional support at a time when older carers most desperately needed it. We've been on the front line of support in health and care services in Wales throughout the last year, providing practical support like PPE and desperately needed respite care where possible, much needed financial support, as well as online social and emotional support. We've been raising issues publicly with the councils, with health boards and with Welsh Government, providing a voice for older carers, and working with colleagues in professional bodies to improve understanding of the challenges older carers are facing. That support has been both online and in person wherever possible. Our charities have done everything they can to address the challenges the pandemic has thrown at older carers over the last year. They have been creative, and we have been dedicated in reaching and supporting older carers. We have worked non-stop to deliver this support throughout the last year, and we know that the pandemic has shown the amazing dedication and skills of so many. In particular, we've been recognising the important and incredible work that health and care workers have carried out across Wales. But it's really important to recognise that staff across charities throughout Age Alliance Wales have shown an incredible dedicated effort and level of skill over the course of the pandemic. It is vital that this work is properly recognised and effectively funded in the future. Thank you.
And a huge thanks to Simon for recording that message for us. Rachel, can I ask you to make a contribution from Age Connects?
Yes, of course. Thank you, Vicky. Good morning, everybody. I'm going to try and cram lots of information into about 5 minutes, so bear with me. I'll do my best. Vicky has said, I'm going to talk to you about the work of Age Connects, but actually I think that would provide too narrow a lens, really. I've been incredibly privileged to be able to experience the pandemic through a number of different lenses, one being the chair of the Regional Partnership Board and also being involved in Test, Trace and Protect in Cwm Taf Maganog. And as a result of being part of something much broader, I guess, I've been exposed to so many different wonderful stories and examples of how the third sector and community-led action, I think, generally has made such a difference to the lives of people of all ages in our communities. But in particular, some of the services that Age Connects organisations and their partners, we couldn't do any of this on our own, actually. We've been providing from March last year, been providing shopping services, prescription collection, walking pets, helping people keep in touch with their friends and family that they may not have seen. And some of those people were actually in step-down facilities or field hospitals, or in other day settings. And so that function was incredibly important for people who hadn't seen their friends and family for maybe months at a time. There was a mentoring service set up to support the people that were living in isolation, to make sure that they continue to talk about their experience and actually build some resilience and some preparation towards lockdown being relaxed and then being able to come back out into community and live the life that they did pre-COVID. And that work has been incredibly important right across Wales in making sure that people have the opportunity to talk about their real lived experiences. And then we try as an organisation to put that into some sort of overall picture and present that to local and national policymakers, as Simon has said. Checking in services. I know that Age Cymru were providing a check-in and chat service, and this was pretty much replicated throughout Age Connect's organisations to make sure that, again, people had an opportunity to pick up the phone and just check that, they understood the guidance, that they knew what they could and they couldn't do, but also that they got access to whatever support was available. And I think the key thing that we discovered was that so many services changed, access to so much support changed literally overnight, that it was a really difficult landscape for people to navigate. They just generally didn't know what was happening, and an awful lot of those changes, unfortunately, were coming through social media channels. And we know that over 40% of older people, of over 75 certainly, are not online. And so that form of communication had to be challenged fairly early on to say, these messages are not getting out to the people that they need to get out to. And so we work very closely with our local regional partnership boards and TTP programs to make sure that they got the information out in accessible formats to people of all ages. We created activity packs, we created online choirs so that people could get involved in more enjoyable activity while they were at home, online dance classes, and of course we maintained all of our usual services, our hospital discharge services, our volunteering programs. We work very closely again with TTP teams to make sure that we could support their food distribution networks. More recently, certainly in Cwmtaf Morgannwg, we've had an enhanced food offer that is aligned with the community testing programme, and that's proved really important, that people don't have to learn how to do online shopping if that's not what they're comfortable to do, but they still have control over the food that they get. And so the volunteer will turn up with a voucher for a set amount of money and say, okay, you know, what is it you like to eat? And I think that's really important, rather than handing somebody a box that's full of food that they probably wouldn't enjoy. So information and advice service has been incredibly important throughout this period. As I've said, this is in addition to the check-in and chat and the mentoring services that we've provided. And, you know, the information and advice services are absolutely fundamental. They provide the basis on which all other services are provided, and that information and advice can come from through a local authority, it can come through a third sector organisation, and unless those services are well supported and seen as an absolute core bedrock of what our communities need, at whatever age they are, but particularly older people, then access to any other form of support becomes more difficult. So, you know, I'm delighted that we've managed as an Age Connects movement, we've managed alongside Age Cymru and other partners in this room today to continue to provide a range of information and advice, and where we can and where it's been safe to do so. We've also continued to support people at home, continued with our nail cutting services to make sure that people didn't become unsteady on their feet and have an increased risk of falling, either in the home that they were isolated in, or when they decided to leave home and step back out into, you know, into society. So, you know, a lot of maintenance of services happening, but actually a lot of new stuff. And I think as well, Vicky, I'd just like to say before I finish, is that, you know, so much of what we all do as charities with either large groups of paid staff or large volunteer workforces, we couldn't have done any of it without the response from communities themselves. You know, the response that they just rallied together, got in touch with us and said, what can we do? We don't want to really become volunteers, but how can you help us help the people in our streets? We don't want to have to be part of something formal and structured, but we do want to help. And I think that was really important for us to recognise that, you know, any help is better than none. And if we could provide a bit of a safety net for those people so that they understood what the role of a volunteer was and what some of the barriers, some of the boundaries, sorry, are, then, you know, they managed to get on and do that and add a huge amount of extra capacity and resource to what we were all trying to do very quickly, I think, in very difficult circumstances. That's all from me. Thank you.
Thanks, Rachel. That's brilliant in terms of talking to us about the breadth of delivery that's gone on across the third sector. And I think we'd all echo the points you make in terms of services like advice being fundamental to everything else, and the value of the contribution from our communities, whether in informal or formal volunteering. Thanks, Rachel. I'll move now straight on to my other colleague, Rachel Nicholson from Hourglass, who's going to talk to us about elder abuse issues during the pandemic. Rachel.
Thank you, Vicky. Yes, my name is Rachel Nicholson. I am the director of Hourglass Cymru, formerly Action on Elder Abuse Cymru. And as a charity, we focus on the abuse of older people and promoting safe ageing. So just as to start off, really, older people are abused daily, even before the pandemic. They're abused physically, sexually, psychologically, financially, and they're also neglected. Their basic needs not met, adequate food, heating, clothing, or being denied medication, access to medication. This is older women and older men, those from all backgrounds, all ethnicities, no matter which sexual orientation or gender identity, socioeconomic status, religion, or political persuasion. And perpetrators are paid professionals. They're strangers, they're family members, sons, daughters, grandchildren, partners. They could have been experiencing abuse more recently since they had started being perceived to be more vulnerable, or particularly in the case of partners, intimate partners, they could have been abused for decades. So at the start of the pandemic, Hourglass was extremely worried that older people who were shielding at home would be at an increased risk of abuse, living potentially with those that are abusing them, so family members or intimate partners, now in a pressure cooker environment, unable to leave home, when tensions were high, people losing their jobs or consuming more alcohol, and when those natural safeguards with care workers being going in to see people, or older people going to libraries, community centres, being able to see their GPs or dentists, all of that removed. And then conversely, we saw older people who were isolated and lonely, unable to see family members and at risk of exploitation. So we all know, we saw this, and sort of, you know, we've already spoken about this and Rachel's spoken about this. We saw this wonderful community spirit come together during the first lockdown, people coming together to help their neighbours. But there were also scammers approaching vulnerable neighbours and vulnerable older people and taking money for shopping that never arrived. And we even know that older people have been charged money for vaccinations and injected with who knows what. And COVID became weaponised. Older people being threatened that if they didn't do as they were told, that the perpetrator would come back and you're more vulnerable to COVID. So I'll catch it, but you're the one that's going to die. And we've heard those stories. And older people became more hidden than they were before. So nobody was seeing them. Nobody was spotting the indicators that abuse might take place. And we were concerned that those older people had nowhere to turn. Thanks to Welsh Government, Hourglass was able to temporarily employ a dedicated and the first helpline information officer for Wales and recruit fantastic volunteers who've been incredible, who are there to listen, provide emotional support and signpost to other agencies, some within the Alliance. And we also introduced the new entry points to services, something we did across the UK, including instant messenger and text. And although they're not necessarily always accessible to older people, as Rachel said, a lot of older people are digitally excluded, other family members and those concerned about an older person could contact us that way. And we'd already recognised that these other ways to contact us were important, but this was driven home when a gentleman emailed us on behalf of himself and his wife, and they were, in his words, being terrorised by their doctor, who they were now forced to live with. And he said they were not even able to leave the house for respite. He was verbally and physically abusive, and he was emailing us because he was monitoring their phone calls. So in Wales, as well as the work of Age Alliance Wales, one of the most significant responses to the pandemic and lockdown was the Older People's Commissioner for Wales bringing together key organisations, charities, public and statutory agencies to form an action group on abuse, attended by a Welsh Government official. So this group has brought together resources, shared expertise, raised awareness of the potential of abuse, and used a collective voice, very much like the Alliance, to reach as many older people as possible, to ensure that they know they are not alone and that support is available. And this needs to continue. The abuse of older people was always here and it won't go away, even though many of us are working to put ourselves out of job and that be the case, but it won't go away anytime soon. And even when restrictions are lifted and we emerge into this new normal, we still need support for people who are experiencing or at risk of abuse. So it needs to continue. The work of the Action Group on Abuse, Age Alliance Wales, and the work that we're doing on abuse, and others to raise awareness of abuse, ensure that everyone knows how to respond when they spot the signs of abuse and how to support older people. But we need the resources, we need the refuge spaces, the services for those experiencing abuse. And we need to create a Wales where we can all grow old safely.
Thanks, Rachel. It's a really powerful contribution about the importance of safety for all of us. So thank you for that. I'm going to move straight on to some other video messages that members of the Alliance have recorded for this session. So there's 3 in a row. Naomi, first one from me, bizarrely, followed by Andrea Nicholas-Jones and then Mary Cowan. Age Alliance Wales is a network of 25 national voluntary organisations working primarily with and for older people. We have a shared commitment to improving the policy framework for older people and a commitment to improving the lives of older people in general. The pandemic has been a particularly challenging time for older people in Wales, and Age Alliance members have spent the last year ensuring that their services are adapting to meet the new and emerging needs of older people, whether that be providing additional information, changing the hours of work, and doing new services for older people, for example, food delivery, prescription delivery, and adapting services so that they're accessible online. Carers Wales delivered their Care for a Cuppa sessions, providing opportunities for carers to relax and have a chat. And Stroke Association delivered Here For You, matching volunteers to those needing a befriending service. Our main ask for the next Welsh Government is that they recognise and value the work and the services delivered by the Age Alliance Wales members, and that they continue to engage with us and support us so that we can keep delivering for older people in Wales.
At Action for Elders, we've supported older people across Wales since 2012 with our Balanced Lives programme. The Balanced Lives programme is based on Tai Chi and meditation and mindfulness. It's developed to ensure that people can optimise their physical and mental health and well-being. When the pandemic restrictions hit, we quickly realised that all of the older people that we were supporting were likely to be left and become even more vulnerable. Initially, we started with our tutors making telephone calls to make sure that people stayed connected, and we encouraged our participants to contact each other and provide peer support through the first really troubling times. We then decided that the best way we could continue to support people was to make our programmes deliverable remotely and digitally. We put considerable effort and investment into developing a way of Zoom calling people and providing sessions via Zoom. And we also produced YouTube videos that people could access in their own time in their own homes. Doing this, we've managed to support over 250 new people during the pandemic who were previously involved in our programmes, whilst continuing to support the participants we already had. It's been really important in these times when people have been shielding and have been socially isolated and lonely, that seeing the friendly face, even if it's just via Zoom or via a YouTube video, is sometimes the only physical contact people feel they will have had with somebody during that week. It's incredibly important that we continue this programme even beyond lockdown restrictions being lifted, because for some older people, their mobility and their confidence will have been so badly affected by shielding and staying within their own homes. It's going to take some quite considerable time before they feel confident to get back out into the community again. We are committed to restarting our community programmes, and that will be our priority as restrictions are lifted, as well as sustaining those digital programmes which will keep people involved and included even within their own homes.
Some of the strengths of the Alliance is around being a collective voice, and that's particularly important for organisations like mine at Cymru versus Arthritis, because those of us who work with condition-specific organisations, we can draw on that greater breadth of knowledge and that experience of others within the Alliance as well. It's a real strong sharing point to look at those common issues and those common agendas that are affecting all of us, but namely to support people living with conditions in their elderly years. And collectively, we can be a lot stronger in how we support older population in Wales. Collectively, coming together to share that voice, to really build on what each other are doing and saying, but find those common themes and those common pictures of life for an older person in Wales as well. Together we're stronger. We've all had some really strong, good programmes and projects that we've worked on. We are such a strong breadth of organisations in a number of different areas of work, and the data that we gather and we collect from the things we do, our services and our beneficiaries, create a really big rich picture of what it's like to live in Wales with an older person and support an older person as well. And I think for that strategy and policy to work then, we've got to see that bigger picture, and that's what we do as an alliance. We can bring that jigsaw together then of Wales's operating landscape. We don't want to reinvent the wheel. We don't want to replicate what each other is doing. There's some phenomenal stuff out there, but being able to share what we're doing, look at those issues, how we can all come together to resolve those and solve them, is a really good, strong point for us.
Lovely. I love that jigsaw analogy, Mary. Thank you for that. I think that that really does work in terms of us together, providing a really good picture of what's happening across Wales. So our final speaker on the agenda before we move to questions is Hugh Owen from the Alzheimer's Society. Hugh's going to talk to us about the manifesto asks.
Morning, everyone. Thank you, Victoria. Yes, my name's Hugh Owen. I'm the Policy Officer at Alzheimer's Society Cymru. For those of you who don't know me, there's a few new faces in the room, so that's me. At Age Alliance Wales, we believe that the human rights of older people have been seriously compromised and neglected throughout the pandemic. We therefore urge the next Welsh Government to consider the following 4 key asks. We ask the next Welsh Government to recognise the value that our member organisations have played during the pandemic so that they can continue to support our older people, not only through the rest of the pandemic, but through any recovery period and beyond. We also call on the Welsh Government to ensure continued and enhanced funding for our organisations so that they can be there to help our older people in a continually challenging world. We call on the Welsh Government to consider funding to help to invest in digital inclusion support and targeted resourcing to enable more people to engage with us digitally, and for redeveloping our face-to-face self-management workshops and packages to be delivered virtually. We also call on the Welsh Government to consider a balanced policy that enables essential services and communications work to continue to be available to vulnerable older people and to support them in understanding the consequences of different lockdown scenarios. There's not much else I can add to that, unfortunately. I think that's all fairly self-explanatory and very clear. I'll hand back. Thank you.
Thanks, Hugh. That's great. So that brings us to the conclusion of our formal contributions and speakers. So thanks to colleagues for their contributions there. Are there any questions that anybody'd like to ask? Alison.
Hello there. Thanks, Beth. That was really eye-opening. I'm in Montgomeryshire, and I wondered what resources you have for me to be able to understand the situation for older people and vulnerable people and carers in this area.
Well, if I can kick off with a response and then bring in some colleagues. One of the things that we did over the last few months is a survey of older people, understanding their experiences. So we can certainly share that with you. It's broken down by local authority area, and so you can see the differences there. But we're actually redoing that survey at the moment. So in a couple of months' time, we'll have some more up-to-date information, probably reflecting the second or the third lockdown as it has been in people's experiences in there. Does anybody else want to contribute in terms of that more locally based information? Rachel.
Yeah, I suppose the easiest and quickest answer, Alison, is they would be an Age Cymru brand partner, I think, in that covered by in Powys?
Powys.
Yeah. And I think that the PAVO, which is the local CDC, would have a range of information that could tell you what was available. So I would probably direct you either to the Age Cymru brand partner or to PAVO and ask them what they've got. They can share with you. I'm sure there's plenty available.
That's helpful, thank you.
Any other questions that anybody'd like to ask?
Okay, just Jeanette Bourne, not a question, just on the back of what Alison was asking. I mean, as an Age Alliance member, obviously you have access to all of our direct services. So we're Cruse Bereavement Care, and of course bereavement before pandemic, and obviously concentrated because of the increased deaths in the pandemic. More people are being bereaved. So yeah, just look us up, cruse.org.uk/Wales, and you'll see the access points for all of our services. Obviously there's been increased demand, and like all of my other fellow members, we've experienced the added layers of loneliness and isolation on top of grief, the digital exclusion side of access to which Hugh was just talking about. But the services are there and they are accessible, and new services have been introduced during lockdowns to make it more accessible for people. So yeah, just on that.
Thanks, Jeanette. And I think it's useful to point out that the websites of all the Alliance members are available on the Age Alliance website itself, so you can click through from there to all of the 25 members. Any other questions or contributions that anybody'd like to make at this point? Alison.
I've got just one more. I just wanted a little bit more detail on what you meant by digital inclusion support. What does that mean practically, please?
Does anybody want to take that, or I'm happy to? Andrea.
Yeah, what we've been doing as part of our programme is, obviously when we moved to delivering remotely, we were very aware that older people are largely digitally excluded. So the first thing that we did was get a digital trainer who was able to support the older people who are in our existing programmes in accessing them remotely online. The second thing we realised is a lot of older people don't have access to any digital technology either. So we were lucky enough to get a grant from Big Lottery, which enabled us to buy some tablets, which we gave to and didn't have any digital technology. And again, our trainer is able to remotely access those programs and set things up for them. So as well as doing our programme, he set up Zoom calls for people to get in touch with their family. He's enabled people to use FaceTime and Facebook. And then the last challenge we found was that not only did some older people not have any digital technology, they didn't have Wi-Fi either. So we've purchased dongles, which we're able to loan out to people as well who are participating in the programme. So we can provide the whole package. And what we're looking at doing at the moment is how we can expand our ability to include older people digitally, but through purpose. Because older people, again, if they've got a purpose to becoming online, they're more likely to do so than just being told you need to get online to do X, Y, and Z. So we're sort of using, if you get online, you can join in our book club, you can join in our exercise class, you can meet with your friends, but also you'll be able to talk to your GP via eConsult. You'll be able to do your shopping, so you don't have to go out. And the big thing is you'll be able to keep in touch with your family, because you're now going to be able to use your camera and all sorts of different things that you couldn't use previously. So that's the way we're trying to increase inclusion, but through purpose.
And can I just add, Victoria, for everybody, I'm a member of the Welsh Government National Advisory Group for Suicide and Self-Harm, and it was through that arena the other day that we learned that actually the Welsh Government are just appointing 3 chief digital roles to look at the whole sort of digital footprint that we have, not just the speeds, but the access through websites and all aspects of digital and for people in Wales. Because I think the general consensus was, which is why those roles have been introduced or about to be introduced, is that there's a lot of confusion about, you know, where services are and et cetera. And we talk about DAWIS and all those types of accessible information points, etc. So just to update, that was all that was said, but there's 3 chief digital roles being introduced to look at the whole strategy.
Thanks both. I think that's really helpful, comprehensive answers on digital inclusion and exclusion, because you know, so many older people experience one of the types of digital exclusion that Andrea described. And I think the percentage of the population that goes online decreases with age. So we know significant numbers of over 70s are, you know, never go online, and that increases as you get into people get into their 80s and 90s. And it really impacts on their way to access, on the way they access information, because one of the things that struck me very early on in the pandemic was, if we heard one of those news reports giving advice, if we didn't understand it or we wanted to double check, we triangulate by going online and Googling it. And if you don't have that sort of facility, it does isolate you even more. And I think that's been evident to us, and that's why so many of us have focused on supporting people to get online over the last year. Any other contributions from anybody? Rachel.
Yeah, Vicky, just wanted to say, of course, that, and I'm not sure whether the 3 roles that that Jeanette has mentioned are linked to this, but I think in 2024 or by 2025 there's a plan to do away with all landline telephones, so everything will be digital. So you know, people will have to have a mobile phone of sorts. You know, that very similar to when analog TV situation came, where we switched from analog to digital. And I think that, you know, that in itself raises questions for all of us that are involved in working, not just with older people, but with people with, you know, sensory loss, you know, any sort of dexterity issues. How are they going to be able to still use their large button telephones, you know, if that isn't actually something that is going to be available to them because it doesn't link with a new digital system. We do have to think about, you know, how are we preparing ourselves as organisations to prepare the people we support. And I think as well, you know, one of the other challenges that we found was, there was, as Andrea said, there's so much that you can do with digital. You know, there were loan schemes through Digital Communities Wales. They gave our organisation around 30 sort of tablets that we could then, our staff could take out into the community and out into the field hospitals and the step down facilities. But actually, our staff weren't very digitally savvy. They themselves hadn't really needed to use that kind of technology before. So there's a whole issue about, you know, upskilling everybody on digital, because it is going to be the way the things are done much more often, and that is going to exclude people, and it is going to create that further sense of isolation. So whilst we want to make sure that we support them to do what they can and what they want to, we also need to be pushing back on some of this stuff and saying, hang on a minute, this, you know, just throwing pieces of kit at organisations and saying, here's 30 smartphones or here's 30 tablets isn't enough without the longer term support for them to upskill themselves, and the volunteers that they inevitably rely on to deliver these programs of work, because it would just be incredibly expensive for it to be delivered through vast numbers of paid staff. And, you know, lots of volunteers want to get involved in that kind of thing. That is absolutely at their street, but it takes time. It can't happen overnight. I think that we had to react very quickly back last March, and we've continued to react and adapt over the course of the pandemic period. But we have to move away from that reactive position at some point and start to really think about what is the next 5 years going to look like as we move into from a pandemic situation to an endemic situation where we are living with coronavirus, maybe not living with the levels of infection, hopefully, fingers crossed, that we have been, but certainly living with the impact. And so that has to form part of the recovery plan, doesn't it? I know Welsh Government are working on their recovery plan, regional partnership boards are working on their recovery plans, PSBs are, and as organisations, you know, we have a role in our own recovery as organisations to support the people that we work with. So just to flag that thing up about the long-term digital impact, I think, around mobile phones and landlines, I think is going to, again, disproportionately affect older people more than probably any other age group.
I think it's a good point, Rachel. I think there's a really low awareness of that change coming, and a lot of work for organisations like all of ours to do with Ofcom to make sure that actually they do start to raise awareness and understand what it really means for people. It's a bit like some of those other major switches we've had in the last decade or so with the digital TV, thinking about, you know, what people have been doing with smart meters. And actually this one around telephony, I think, as I say, is very, very low awareness so far. And actually we're hurtling towards 2025 at a frightening rate of knots, really. So we have had a couple more comments in the chat. Katie has a question there around mental health support and funded, and how can we work together to make sure mental health of older people is addressed as a priority. Katie, do you want to add anything there?
No, I think it's just that Helena Herklotz was at one of our recent meetings, talked about this being one of her priorities for the coming year and beyond. And, you know, I know that mental health is something that all charities working with all ages are very concerned about coming out of the pandemic. And I think that's right. But just that concern really that, you know, Helena touched on this at the time, that funding is often skewed towards younger people, and the older people's funding often focuses on dementia. And you know, we know that there's a lot more that needs to be done, particularly when we're talking about the effect of a year-long isolation for some people. So yeah, I just think it's a real priority, something we really need to kind of all get together and put our weight behind to raise awareness of.
Vicky, could I just say on Katie's point that there is a toolkit that I've had sight of as a result of my involvement in the TTP programme in CTM, right, I always get this wrong. It's the Regional Partnership Board in Swansea Bay, I think it's called, or West Wales. No, they're two different things.
Western Bay.
Western Bay, thank you. They've completed theirs. Joanne Abbott Davis has completed this. It's a mental health assessment, population assessment, and I think it's the Centre for Ageing Better actually that produces the toolkit. So we're working through the National Protect task group, Protect being the one element of Test, Trace and Protect. For all regional partnership boards and PSBs to work together so that they all use this toolkit and to give us an idea of what are our mental health needs at the moment. And I think as well, focusing on mental well-being being quite different to mental health, and you know, recognizing that there will be existing mental health services that are supporting people that have probably been using those services for some time. There'll be people that have entered those services with very clearly diagnosed clinical needs, but then there will be a whole raft of people that are going to reach those thresholds and those points if we don't get something in place very quickly and appropriately, and that we don't rely on a kind of referral to treatment type of model, which isn't what we want. We want the referral to, you know, we want the social prescribing or type of arrangement where we are referring people to organisations like Andrea's, you know, where they can get that therapeutic support without having to navigate through a very complex mental health, clinical mental health environment. So I'm quite happy to share that, Vicky, if I send it through to Chris and he can share it with people in the meeting.
I think that'd be really helpful, Rachel, and perhaps that's something that we could have a look at as an alliance, to make sure that we're all cited on it and that we're actually all using it, because I imagine that lots of us have some intelligence that we could share with the regional partnership boards as they're doing their work on that.
Yeah, absolutely. And I think, you know, we've done this in the past, haven't we, as an alliance? We've written out to partnership boards and we've asked them, what are your intentions around scoping and modelling mental health support going forward and mental well-being support going forward. And I think it would be a good time to do that, because there is a lot going on in the children and young people's world. And I just think that we need to be careful that that doesn't, we older people are not left behind.
Yeah, which brings us back to Katie's point. I think that's a really positive action that we could take on that point as we move forward. Lovely. Anything else anybody wants to share or to say this morning? No. Well, can I thank all of my colleagues at Age Alliance for the fantastic work that they do on a year-round basis, all year, every year, and particularly to colleagues that have contributed to our asks this morning and that have made presentations and have recorded messages. And thanks to everybody actually at the meeting for taking the time to join us this morning. So thank you, everybody, and I look forward to seeing you all again soon.
Thanks, Vicky.
Thank you.
Thanks,
Thank you,
Vicky.
everyone.
Bye.
Bye.